My name is Jerimiah Miller. I'm a dermatologist at Greenville Health Systems at Carolina Dermatology. And today we're talking about skin cancer as well as sun protection to prevent skin cancer. So the images in this talk are courtesy of the AAD, which is the American Academy of Dermatology. Otherwise, I'll note if it's from another source. So there are three types of skin cancer that we commonly see. That's basal cell carcinoma, squamous cell carcinoma, and melanoma. And basal cell carcinoma is the most common. There's about 3 million per year. And generally this is from both sunburns as well as chronic sun exposure. So we commonly see this on the nose, on the shoulders. This has a very good prognosis if it's treated early on. Squamous cell carcinoma is the next most common, about 700,000 per year. And this is typically from chronic sun exposure. So this is typically going to be in someone who has spent a lifetime outside, like a construction worker or someone who is out on their boat every weekend. And this is typically going to be on the arms, on the face, even on the scalp. And then the least common type of skin cancer, but the worst prognosis, is melanoma. There's only about 70,000 melanomas per year diagnosed in the United States, but melanomas cause 75% of the almost 12,000 deaths we see from skin cancer. So this is the one that really has the highest likelihood to metastasize and is the one we really worry about. So I'll just show you a few examples of different types of skin cancer. This is a typical looking basal cell carcinoma. It has what we describe as a pearly appearance with these rolled borders and these dilated blood vessels. And there's multiple subtypes of basal cells. There's nodular, superficial, pigmented, and more morphiiform. And again, if we treat these early, the prognosis is usually very good. The next most common type, again, is the squamous cell carcinoma, or SCC. You can see this is on the scalp, it looks like, and has that keratin in the middle. Another squamous cell, again, you can see that keratin in the middle of the lesion. And then the other thing to discuss with you are actinic keratoses. These are from sun also. These are considered precancerous. If you leave these untreated, a small percentage of these can then transform into a squamous cell. This is on the scalp of a patient. So we normally treat these lesions to prevent progression to squamous cell carcinoma. And then melanoma, again, this is the one that has the worst prognosis. And you can see right away, these are very obvious examples, but the discoloration, the asymmetry, they just look bad. And about half of melanomas will develop from a pre-existing mole. That's why we are very careful to monitor and observe moles. And in this patient, you can see the transition from a benign appearing mole over time then to this melanoma. As you can see, it became bigger, it became asymmetric, the borders are irregular, and the color is not uniform. So an easy tool to screen yourself for melanomas is the A, B, C, D, E's. So A is for asymmetry, B is for borders that are irregular, C is for color that's not uniform, D is for diameter, which is usually greater than 6 millimeters, which is the size of an eraser tip, and then E for evolving. So if you have a spot that's been stable and then all of a sudden it changes color, it changes shape, it starts bleeding, then you would want to see a dermatologist to have that assessed. So then the question is, we've talked about all the skin cancers, why protect yourself from the sun? Well, there's a few reasons. The first is just morbidity and mortality. So as I mentioned, 12,000 Americans die per year from skin cancer. Again, most of those are from melanoma. But usually with a basal cell or squamous cell, if we can treat them early, the chance of them killing you is very unlikely. However, the morbidity is very significant, and I'll show you what I mean. You can see in this picture, this patient probably had a basal cell carcinoma on their nose. And again, a basal cell is probably the best skin cancer you could get because it very, very rarely metastasizes. But you can see that basal cell was a very difficult procedure, and the patient obviously had some pain with the procedure, and then they're obviously going to have a decent scar when the procedure is done. So there is a morbidity associated with even the basal cell carcinomas. The other thing, if you don't care about that, is aging. So this gentleman spent 30 years as a delivery truck driver, and he often had his windows down. So you can see on the left side of his face, which was the side of his face exposed to the sun, he's probably about 15 or 20 years older in appearance than on the right side of his face. So aging is a very huge problem due to sun. So then if we're going to do sun protection, how do we do it right? Well, your sun screen should have the following features. It should be an SPF of at least 30, and it should be broad spectrum, which means it protects you from UVA and UVB. You should apply it every 2 hours, especially if you're outside sweating or swimming. And most people do not apply an adequate volume of sunscreen. They typically put on too small of an amount. So put on more than you think you should use, and a good rule of thumb is 1 ounce should be the amount you use to cover your sun-exposed area. So that would be your face and your arms. Avoid prolonged sun exposure from 10 a.m. to 4 p.m. Wear clothing with an SPF built into it whenever possible. And then children less than 6 months of age should have no sun exposure. And a lot of people now are concerned about the ingredients in sunscreens. There's very little evidence to suggest those ingredients cause any systemic harm to the body. However, if you are concerned about that still, the best sunscreen to use is a zinc or titanium-based sunscreen, in addition to sun protection clothing and wide-brimmed hats. So this needs its own slide. Absolutely avoid tanning beds. There's more and more evidence coming out linking tanning beds to basal cell carcinomas, to melanomas. Personally, I've seen the damage that these do in my own patients. So there's absolutely never, ever a reason that you should go to a tanning bed. It's right up there with smoking. So then what about vitamin D? If we're protecting ourselves from the sun, are we getting vitamin D? Well, let's talk about that. So UVB is involved in producing vitamin D within your body. However, UVB is also implicated in skin cancer, but you really don't need that much sun exposure to get enough vitamin D. About 10 to 15 minutes of sun exposure during the middle of the day should give you an adequate amount of vitamin D for your body. In typical circumstances, the use of sunscreen does not lead to low vitamin D levels. And then if you're still concerned, and if you do have your vitamin D levels checked and they are low, you can always supplement with an oral vitamin D. So let's just summarize the key points. Skin cancer is very common. Melanoma is rare, but it does cause 75% of the deaths from skin cancer. Remember your A, B, C, D, E's when thinking about melanoma: asymmetry, borders, color, diameter, and E for evolving. Wear sunscreen, especially when you're out during peak sun hours. Absolutely no tanning beds. And regarding vitamin D, it's very rare for sun protection to cause low vitamin D levels. So you're probably safe to continue wearing your sunscreen, and you can supplement with vitamin D if needed. Thank you for your time today. I hope this was helpful for you. If you have any other questions or you have any concerns, please feel free to contact us at Carolina Dermatology, 233-6338. Thank you.